Hey everybody, welcome to today's call. Not sure how many people are going to be on. I hope a lot of you guys join me because this is a really important conversation that I want to talk about today. This is a really important topic that I want to talk about today because there are so many people in this world that have PTSD. There's so many people in this world that are suffering with post-traumatic stress disorder. My friend, this journey is your own. There's nothing that I'm going to be able to give you that the only thing I can do is inspire you. I can't make you do anything in your life. And that's what I want you to realize today. I want you to realize at the very beginning here that your life, your journey is the one that you develop. And no matter what happened to you yesterday or in the past, your future is unwritten, right? It's unwritten, uncreated. So what you need to do is you need to begin to say, okay, I'm in charge of my life. I'm in charge of creating the life that I want to live. And it's up to me to do that. Right? There's going to become a time in everyone's life, in everyone's journey, that they say, enough is enough. And, some people call this that aha moment, that moment where it's like, yeah, you know what? Enough is enough. I'm ready to take on this next challenge in my life. I'm ready to go after the goals I want. I'm ready to really out to push myself to the next limits, to push myself to the next space, the next area, that next, whatever that next is for you. We all have the moments that we need to find. Now, when I was going through my PTSD symptoms, when I was going through a rough patch in my life, that came after 2 years of suffering with post-traumatic stress disorder. After 2 years, I finally said, look, enough is enough. I've been living down this path for way too long, and it's about time that I take back control of my life. And unless I do something about it, nothing's going to change. And you have to get to that point, my friends, when you get to the point of saying, if I don't change, nothing will. Now, like I said, some people call this that aha moment in their life. And today I want to discuss that with you. And yeah, I say discuss. So please be active in the chat. Ask questions. Let's go back and forth on this. Let's try to understand the things that will work best for us and the things that we can do to create that life that we truly want. PTSD is just a phase of your life. It's not the whole thing, but it is so powerful. It is so big that it seems to overpower our life. It seems to put a bubble around us where it's hard for us to move forward. We can't because we're stuck. And I hope today to give you these I have 10 points today that I'm going to talk about, and I hope to give them to you where you can say, look, I'm going to change my life. I'm going to take that next step and be responsible and really create that life that I want. Now, the first thing that you should do is seek help. My friends, seeking help is not a weakness. It is a challenge, actually, sometimes. It builds strength. It helps to move forward. But like all medical injuries, there's a time for a Band-Aid and there's a time for a cast. And oftentimes when we get PTSD, we're trying to cover up a scar, cover up a wound with a Band-Aid. But it just keeps bleeding. It just keeps resurfacing itself because you can't fix it with that. You have to go deeper. You have to go deeper and say, look, I understand that I need to seek help. And I was speaking to a friend yesterday, and he talked about when he seeks help, he finds it frustrating to go to a therapist or a counselor because they bring up the things again that he's already pushed down. Now, for some people, if it's not holding you down, if reliving that event is just going to cause more issues than resolutions, don't do it. And that's my advice for you. I found the same thing as he did when I went to a therapist. She would bring up past events that I had already kind of dealt with and locked away. And if you've done that, be your own person. The world society sometimes tells us that we need to go and say, okay, I need to talk to somebody about this. I need to get help. I need to get this out. And if that works for you, great. If it doesn't, great. Figure out what works for you. But have a community. Have a support center that's going to say, I'm listening. And when you're ready to talk, they'll be ready to listen. But use this as a tool. Use this as something that's going to give you that next step, that's going to push you to that next level. And that's what all these are to do. They're just to give you tools in the toolbox. You don't have to go through and be like, okay, step 1, get help. Step 2, educate myself. Step 3, practice self-compassion. Step 4, right? Like, you don't need to do that. You need to go, okay, what's going to work for me to have the best life possible? And if seeking therapy, counseling works for you, then do it. Maybe in the beginning, medication will help because then it can kind of soften the triggers. It can soften the outcomes that you're feeling, all the pain that you're feeling. It can soften that, and it'll allow you to move forward. It'll allow you to give you that space to rebuild your life. But over time, the pain will be less, no matter what you do. Right? It's when someone passes away in someone's life. Let's say we've lost a mom or a dad, and it's hard. But 5, 10 years down the road, it's not going to be so painful because you'll have created a new paradigm, a new habitual way of thinking that person's been gone. It's the same thing with my son. I lost my son over 12 years ago. It's a lot easier now than it was day one. But we get so stuck in day one that it's hard to understand that there will be 12 years down the road. And that's why I want to reassure you, my friend, you're going through a phase. This phase is going to overcome, and you are going to be able to create that life that you want. Now, the second point is to educate yourself. What is it that you're going through? What are your triggers? What are your symptoms? Why are you feeling the way you feel? Now, I talk a lot about PTSD and what it is, and there's a lot out there about it. And in my definition of post-traumatic stress disorder, it's a confusion state of the mind. And if you define each word in post-traumatic stress disorder, post is past, traumatic is an event that has caused pain, stress is a confusion state, and a disorder is what it is. So it's basically a confusion state of the mind. Something's happened in your life that you didn't perceive as a reality, and now your mind is going, wait, that's not true. That should not have happened. And your mind can't create this. So it causes a new neural pathway, and it causes you to start thinking things differently and going, oh, this is the way life is. And you create triggers, you create panic and say, you're in hypervigilance mode. That if something happens in your life, you're like, whoa, okay, I need to prepare myself because this happens to me all the time. And that's where our mindset goes. It's there to protect us. But when you can learn to educate yourself and go, okay, that's not what's going through. I understand that I might have triggers. Certain places and things might create more of a thought pattern for me, and I can really create my life and move forward. That's when we can shift our lives. Knowledge is power, and it can help you recognize what you're doing and how to overcome it. We all have coping mechanisms that we've created within ourselves. And when we deal with these coping mechanisms and learn to adjust ourselves to them, that's when your life will transform. That's when you'll go, okay, I'm back in control. I'm back in control of my life, and I'm learning how to shift it in the right direction. Now, you also need to practice self-compassion, self-love, self-forgiveness. What happened to you sucked, right? There's no simpler way for me to say that. What happened to you is brutal, and what you went through is tough, but you can overcome it. You can create that love, but you have to first forgive yourself. You have to first say, look, I'm sorry, me, for what I went through. It wasn't right, but I've been through it, and I am stronger because of it. You'll see that repeated in a lot of my trainings because I find self-compassion is so important that we don't do it enough. We don't tell ourselves, we don't move ourselves into that place enough to say, I love myself, that this was just a phase that kind of broke me, but I'm going to move myself into that next area of my life. When you can forgive yourself and others, this begins to rebuild your life into that next area, begins to rebuild your emotional state to allow for new experiences to happen. And it will release and create those past experiences and create new ones. And that's what we're going for. We're always trying to create new experiences, my friends. We're all going to have difficult days. I want to remind you that no matter what you've been through, you will have difficult days again in the future. It's just the way it is. But if you can build resilience and you can prepare yourself for that, that's when your life's going to be in your control. Always treat yourself with kindness. No matter what you've been through, no matter what's going on, always put yourself first. Always be kind to you, because that's when your life is going to transform. Don't rely on other people to be kind to you, but rely on other people to be there for you, to talk to you, to be that shoulder to lean on. You need to have a support system. When I was first going through my traumatic experience, I had people around me and they'd be like, "How are you doing today?" "You know what? Today's a rough day. I'm not doing so well." "Okay, well, let's go for a walk and talk about it." I had that support system. And if you don't have people like that, you have to make the choice, the responsibility, and go do it yourself. You have to find people. There are people out there like myself who want to be there for you, who want to give you that opportunity to speak if that's what you're ready to do. But it's your life, it's your responsibility to say, okay, I need some people around me. I need people that will understand what I'm talking about, to feel my concerns, to make me feel safe that what I'm going through isn't wrong. And what I feel on a day to day basis isn't wrong. But sometimes we feel that way. And sometimes when we begin to create that life, we begin to create that emotional state, that's when we can begin to transform. And we begin to create new routines, new habits, and become that new person. And in the beginning, when you go through your phases of getting out of your suffering state through post-traumatic stress disorder, a routine is one of the best things to do. To establish a routine is going to help you move forward, because it's going to build new neurons in your mind. It's going to create new thinking structures and begin to create that life that you truly want. It gets that confusion state back into a certain routine. And that's what we need right now. If we don't have a structure, everything's going to look confusing until you're ready to move forward, until you're at that place and go, okay, what do I do? What do I do tomorrow? And I've done this numerous times. If I've had to create routines in my life and say, okay, tomorrow, what am I doing? I'm getting up in the morning. I'm going to do this. I'm going to do this. Then I'm going to do this. Then I'm going to do this. I really create a structure in my life. And this allows a lot of the confusion triggers to slowly move away. It takes 21 days to create a habit. So to create a routine in your life, this takes some time. It's going to take some time for you to go through that mindset exercise and begin to create that life that you're truly looking for. So the next step, once that you've created a routine, is daily you need to create relaxation techniques. How do you relax yourself? How do you become that person that you want to be? Because when your mind's so confusing, everything's going on, it builds a lot of stress in your life. It pushes you to the brink. It pushes you to that next area. And until you can say, okay, I need to relax myself, I need to set my tone for my life, you're going to get that confusion state. And it can be very simple. One technique I'll give you right now is deep breathing for multiple times a day for 1 minute. The best way to do that is take your phone. We all have a phone. Set a timer for 1 minute. And then close your eyes. Breathe in for 4 seconds. Hold for 4 seconds and breathe out for 4 seconds. Now I feel relaxed just doing that once. And a minute, my friends, is not that long. You can go to the bathroom and sit on the toilet for a minute, right? Whatever you want to do, find 1 minute when you need it and say, look, I'm getting intense right now. I'm going to pause and I'm just going to set my timer for 1 minute and I'm going to breathe through this. And my friends, that's going to change tons in your life. Maybe you have more time, so you want to try maybe a progressive muscle relaxation. And what that is you kind of tense your muscles and then you relax them. And you tense your muscles and then you relax them. And you keep doing that throughout your whole body. And that's progressive muscle relaxation. And then it gives your muscles the calming of the relaxation feeling. And then third is to get into a deep meditation or a mindfulness exercise. Grounding, grounding is very simple. You sit outside and just close your eyes and listen to the birds. That's grounding yourself because you're bringing yourself in the present moment. So try these things, try these little techniques, and they should be able to help you shift your life. But as always, I say, my friends, find whatever works for you. Find that thing that works for you that's going to help you transform your life. And the seventh thing is you need to engage in a regular exercise regime. What can you do on a daily basis to bring physical fitness into your life? Now, I don't mean you got to go through a Navy SEAL boot camp. Go to the gym, right? Get a gym membership, go to the gym, walk on the treadmill, go for a walk outside, lift some weights, create that in your support system. Have one of them be someone that's going to the gym right now. We all have friends that go to the gym, right? We all have that one person or an acquaintance maybe. Ask them, be like, hey, look, I'm going through something right now. I don't really want to talk about it, but I really want to have a partner at the gym. Would you mind if I came with you? Right? Just maybe once a week for now. And 99% of the time, they'd be like, yeah, of course. Some people are like, no, I like my alone time at the gym. And that's fine. Find someone else. But create a regime that's going to help you exercise, because you got to find something that suits you. Maybe like to swim, right? That's another opportunity. The eighth thing is you need to prioritize your sleep, especially us that have had nightmares that go back through the traumatic experience. If you're having nightmares, get a Band-Aid for that. And what I mean by that is get some medication. There's medications out there that's going to knock you out, help you sleep. Go get that. Make sure that you rest, because I found so much in my life that when I'm fighting a trigger or I'm fighting a symptom and I'm tired, this makes it almost impossible for me to beat that trigger. I give in and I'm like, look, that's fine. I'm not going to do this. I'm beaten anyways. I'm just going to go lay down. And I get into such a low suffering state. For me, my thing is just to sleep. I just don't want to see anybody. I just go and hibernate in my room and go to bed. My wife sees this and she knows I'm going through something. And she goes, okay, we need to go for a walk. We need to go outside. We need to get some energy back into you. And she notices this and she pushes me to that limit. But when you're creating that and you're beginning to live that life that you truly want to live, that's when you're going to transform. That's when you're going to. But you have to be on purpose. I don't know how to say that anymore. You have to be on purpose. And you have to have that sleep cycle so that you're not fighting through that. Right? So some of the tips that I wrote down here is to create a relaxation sleep bedtime routine. What do you do when you go to bed? Do you lay in bed, sit on your phone for 15, 20 minutes and then close your eyes and try to go to sleep? My friend, that's not going to work. You've now just made your brain active. Read a book, right? Read something that's calming. Listen to something that's calming. My wife likes to put on a meditation that just calms us. And I'm usually out within a couple minutes of it, because it's again, I'm going to use the word calming, and I've said it like 4 times now. But really, be on purpose, can create that life that you want. Number 9. Okay. 9 is, if I were to ask you what you would love to do today, what would your answer be? I'll pay for everything. It doesn't matter how much it would cost. What would you want to do? Think about it. Think about that right now. And then it's your opportunity to do more of that. Your life, how many lives are you living? You're not a cat. You're living one. Live it. And once you do all of these other tips and techniques, this point, you're going to be like, look, I'm ready to live. I'm ready to move forward with my life. I'm ready to take on that next challenge. But your health has to be a priority. You have to say, look, I need to take care of myself. It's your responsibility, my friend, to create that life that you want. It's your responsibility to have the the excitement and do the things that you want in your life. Dedicate time to these activities. Whatever it is that you want to do, write it in your routine and say, tomorrow at 11 o'clock, I'm going to do this, or whatever it is. Put that in your routine, because when it's in a calendar, you do it. If it's not, you forget about it. And when in the beginning, to create these routines, it's going to help your mind be less confused, and it's going to allow you to do a lot of the things that you want to do. What are some of those hobbies that you love? What are some of those creative outlets, the recreational activities? These can all provide that positive distraction. And in the beginning, it's a distraction until it's part of your life and part of your routine. And then it builds your overall well-being. And finally, make sure that you set healthy boundaries. As someone going through this, you need to say no sometimes. You need to tell people that you're not ready, that it's not something you want to do right now. And they need to respect you for that. And if they don't, that's fine. Don't give in to it. Just tell them, look, I'm not ready to do that right now. And you can even tell me that. You could be at a place right now in your life that you're like, I'm not ready to do that. And that is fine. Boundaries protect you. They protect you and your well-being. And this might involve saying no to something that you really don't want to do. But that's your life and it's your responsibility. Now remember, PTSD is unique to each person. It's important to find those strategies that work best for you and be patient with yourself. Understand that this is a journey. It's a marathon, not a sprint. For you to get to the other side of this takes work, takes energy, and it takes your commitment and responsibility for your life. So take responsibility now, my friend, and create that life that you truly want. Thank you for watching. I appreciate you all. And as always, I love you all. And there's nothing you can do about it. Bye for now.